Not all women experience pain during the weaning process, especially if they follow the baby's lead and wean the baby gradually. However, some women do experience discomfort during the weaning process, whether they are weaning from the breast or from pumping. Discovering effective ways to reduce pain while weaning can help breastfeeding mothers accomplish their goal with greater ease. Thankfully, there are simple steps that nursing mothers can take to help make the weaning process a little smoother. Start slowly. Begin the weaning process in a gradual, slow manner. Any abrupt cessation of breastfeeding will confuse your body and cause pain, or worse, from engorgement. If you abruptly stop nursing, your body is less likely to handle the transition smoothly, and you are more likely to experience pain. Your body has prepared itself to meet your baby's nutritional needs based on how often your baby nurses. Your body has not been prepared to stop producing milk at a quick rate. It needs time to realize that the milk is no longer needed. Painful side effects of stopping abruptly include engorgement, mastitis, and plugged ducts. If you wean gradually, it will take as long for your milk to dry up as it does to wean, which means anywhere from a few weeks to a few months. If you stop breastfeeding suddenly, the length of time for your milk to dry up depends on how much milk you are producing at the time. If you are producing a lot of milk, it can still take several weeks or months. Watch your baby for signs of weaning. Your baby will most likely let you know when he or she is ready to wean, such as an interest in solid food and a loss of interest in nursing. However, babies should not be taken completely off of mother's milk or formula until at least 12 months, and they should not drink cow's milk until this age as well. You can follow the philosophy of baby lead weaning, which means allowing the baby to eat table food whenever he or she starts reaching for food. Your baby will gradually eat more food than breast milk over the next few months. Follow your intuition with regards to your baby's readiness for weaning. Remember that you are the mother and no one can know your baby better than you. Listen to your baby. Remember that every baby is different. Every mother is different too. Learn from the experiences of others, but don't take them as gospel if you feel differently. Your own experiences are your best guide. At around 5 to 6 months, babies may want other foods despite not having teeth. You can tell they are ready for food by increased fussiness, ability to sit without much help, watching you eat with interest, and chewing motions. Some people think that you have to start weaning when the baby starts teething, but this is not true. It is okay to keep breastfeeding your baby even when he starts teething. Just keep in mind that some babies will bite when they are nursing after they develop teeth, but gently telling your baby this is not okay should be enough to make him stop. Introduce food. To get to the point where food is the main source of nutrition, you should begin slowly. Baby's digestive system is still developing, and he or she will need either breast milk or formula until about 12 months. Start at around 4 months with baby cereal and progress to table food. When introducing an exclusively breastfed baby to food for the first time, express some breast milk and mix it into a single grain baby cereal. This will make it more appetizing and easier for the baby to chew. Food should be introduced at around 6 months. Between 4 and 8 months, you can introduce pureed fruits, veggies, and meats. At 9 to 12 months, you can offer non-pureed finger foods such as rice, teething biscuits, and ground meat. Start to cut out feedings. If your baby nurses every 3 hours, at around 9 months you can start nursing every 4 to 5 hours. Or you can simply skip over baby's least favorite feeding, or the most difficult feeding, and see if your baby notices. If not, keep skipping it. A few days or weeks later, skip another nursing and see if your baby notices. If your baby continues to adapt to the skipped feedings, you can continue this trend up until the last feeding. You may want to keep the early morning and bedtime feedings until the very end. For one thing, you have more milk in the morning after a long night without nursing, so keeping this feeding will prevent engorgement. And the evening feeding is probably part of a comforting bedtime routine, as well as a way to help baby feel full and sleep better. The evening feeding is usually the last one to go. Cut out middle of the night feedings by having your partner or someone else comfort the baby. Please subscribe to our channel and give this video a thumbs up. Share this video with your friends on Facebook and Twitter. Thanks for watching.